Begin tonight with what could be good news. Today, the White House took steps to make a pill for treating COVID available to millions more Americans. Pfizer's antiviral drug Paxlovid has been shown to reduce hospitalization or death in people with COVID by nearly 90%. The drug that was once dubbed the biggest game changer since the vaccine hasn't had a true impact due to a lack of availability. The free antiviral drug is available at about 20,000 sites around the country, but now there's hope that could change. That's not the only headline on the pandemic tonight. There's this breaking news. Pfizer just asked the FDA to authorize its booster for kids ages 5 to 11. That's important because the CDC says 75% of that age group has had COVID at least once. And here in the nation's capital, we learned Vice President Kamala Harris tested positive for COVID-19. The White House says President Biden is not considered a close contact. We have a lot of news to get to tonight, and we'll start with CBS's Mola Lenghi in New York City. Good evening, Mola.
Well, good evening, Nora. The vice president tested positive this morning after starting her day at the West Wing. We should note she is vaccinated and boosted, but that comes with the White House already having COVID at the top of their agenda with the rollout of a new plan to make it that powerful anti-COVID drug widely available on pharmacy shelves nationwide.
Paxlovid is one of the most effective antiviral tools for treating COVID. If only more people could get their hands on it.
Over the last few months, the administration has worked very hard with Pfizer to increase the supply of Paxlovid and acquire more and more doses for the American people.
Until recently, it was hard to find, but with production up, the Biden administration today announced it wants to make Paxlovid available for free and is launching an effort to double the supply, getting the pills into 20,000 more pharmacies over the coming weeks.
If there were ever a drug to ask your doctor for, Paxlovid would be that drug.
It reduces the risk of COVID hospitalization and death by 89% in high-risk adult patients and is already authorized for people 12 and over who are considered high risk, often with underlying conditions like obesity, hypertension, diabetes, and asthma. But it must be taken within 5 days of symptoms, often igniting a race to find a pharmacy that actually has it in stock.
And as you can see, the cough is still working its way out.
Still there.
It's a scramble Gabe Rice knows all too well.
Have you noticed its impact?
Yeah, after a couple of days, I definitely was feeling better, feeling less fatigued, coughing less congested.
Another key tool in a return to normalcy, the antiviral drug remdesivir, which the FDA just approved to treat children as young as 28 days old with COVID. At a time when more than half of all Americans, including 3 out of 4 children, have now survived a case of COVID. Nationwide, COVID cases are up 22% over the last week and 45% over the last 2 weeks. Still, COVID deaths down over that same period, falling 13% over the last week and 37% the last 2 weeks.
Well, also tonight, Pfizer has requested that emergency use authorization for its booster shot in children ages 5 to 11 years old. Based on data they submitted to the FDA, a third dose of their vaccine showed significant protection against the virus in that 5 to 11 age group, Nora.
Lots of headlines there, Mola Lenghi. Thank you.